this goes up, this goes up. Got it? Direct means if this goes up, this goes up. And what do I mean by that? If my resistance increases, is my blood pressure going to go down or up? Up. If my output increases, what's my blood pressure going to do? Also up. And how do we understand this on a mathematical problem? If this one is the numerator, and it's going to equal another thing that's a numerator, and times another numerator, if it's all numerators, whatever this does. It's direct. Got it? It's direct. I'm trying to think of a one that I can do for you guys that you might recognize. Okay, I'll do it. I got it. 10 equals what times what? 5 times? Thank you. Everybody with me? Now, what if I increase this to 4? What's that going to be? Did it increase also? Direct relationship. Because all of the numbers are in the numerator above the line. Got it? Let's go back to the original. What if I bring this one down to 2? What's that going to be?
4.
Is that going to go down also? Direct relationship. If this side goes down, that side goes down. Because it's in a numerator position. Got it? All right. What about 5 equals 10 divided by 2? Where is this one? Numerator. Where's this one? Numerator. Where's this one?
Denominator.
Okay, denominator. Now watch what happens. What if I increase this? If I increase this to 5, what happens to my answer? You know what this is called? Inverse. Got it? Now, I often say this to my students. This is algebra, okay? But not the kind you guys are struggling over in math class. Because this is what the Greeks came up with. They said algebra is designed to explain nature. When this goes up and this goes up, we're going to call those numerators. When this goes up and this goes down, we're going to call this, and we're going to put under the line, and we're going to call it the denominator. It's just nature's way of explaining. Do two things happen at the same time, or do they do the opposite? That's all of nature, okay? And that's the only reason math was invented, was to explain nature. We then made it harder. Got it? With imaginary numbers and all that kind of stuff, and sticking letters in, right? A squared, B squared, huh? Aha. Everybody, listen carefully. Indirect is not mathematical. Indirect has nothing to do with math. So on that test question, don't choose indirect. You can't be indirect in math. So what is indirect? Ready? I want to talk to you, okay?
Well, you have to go through somebody else.
Do-de-do. Hi, how you doing? Going around. Hey, how are you doing? Oh, now I'm where I want to be. Did I directly come to you or go around? What example from the first set of videos, the renin-angiotensin mechanism,
Okay.
Because the kidney made renin.
Then it goes to
But
the
it went
liver.
over here to the liver to get turned into angiotensin 1, went over here to the lung to get turned into angiotensin 2, got it? Then went over here to the adrenal gland to make aldosterone,
88.
which came back to you. See how that's all over the place? So that whole mechanism is indirect. And this is why I push it so hard, because it's going to be in your nursing classes every semester. Because is your heart involved? In the heart chapter, you'll see it. Are your lungs involved? It'll be in the lung chapter. Is your kidney involved? It'll be in the kidney chapter. Okay? And it has something to do with what? Increasing your blood pressure, right? And that's why you need to know what an ACE inhibitor is, because it's going to tell the lung, don't make angiotensin 2, so you don't increase your blood pressure. So that's indirect. What in the angiotensin mechanism is completely direct?
Nothing.
What's the name of this system? Renin, what?
Oh, it directly tenses
Angiotensin.
the
What does the word angiotensin mean?
tensing vessels.
Tense my angios, tighten my blood vessels. Is that exactly what angiotensin 2 does?
Yeah.
It's directly, like its name says, I'm going to squeeze. But indirectly, it's going to tell your aldosterone to be released. Indirectly, it tells your ADH to be released. But directly, it does what its name says. Got it? So I just want you to understand. I've got students always asking me, is this indirect? No, it's inverse. Because indirect cannot be a mathematical concept. Because we don't go around the room to get to the answer in math. Got it? But you do go around the room to do biological things. Okay? So in biology, you've got direct communication or indirect communication. Got it? And why is indirect communication important for us in clinical applications? Because if I don't want to tighten my blood vessels, I've got multiple points where I can stop that. I can stop it here, I can stop it there, I can stop it there. And that's what medicine is. Medicine, like ACE inhibitors and beta blockers and calcium channel blockers, they're all there in different places to get to the same ending, which is bring this guy's blood pressure down. All right? And it's up to the doctor to decide whether it should be this drug or a combination of these drugs. And another thing that's very important, and you'll need to be aware of that, what are the side effects? Got it? Because if the side effect of this drug is worse than that one, your patient's gonna say, can't I be on this one? All righty? So, but that's why we need to know it, all right? Please be aware what BP, CO, and PR stand for. So you'll see that it's not gonna be this over this. They're times each other because they're all directly related, all right? Okay. So, who's going to control our blood pressure? Well, epinephrine, vasoconstriction is going to do what? Make your blood pressure go up or down? Up. Vasodilation is going to make your blood pressure do what? Go down. Okay. And of course, you have what's called a vasomotor center in your brain. I think there's another picture coming up. Yeah, okay. I like this one.
Wait, so those are the factors that influence arterial blood pressure? The
Yeah,
epinephrine?
Yeah, epinephrine. But here's even more.
Okay.
Okay? Homeostasis. Uh-oh, I'm out of homeostasis, right? Okay. Which means my blood pressure is rising. We have to receive that stimulus. How do you know your blood pressure is going up? Well, you have baroreceptors, which receive what? Pressure. and they happen to be in the carotid sinus, where the carotid artery splits into internal and external. There's a hollow space called the sinus, and in your aorta, which makes sense. Isn't that the first place that the blood goes to after it leaves the heart?
Yeah.
So these little guys tell your brain, uh-oh, your blood pressure is what? Too high. So it sends out two messages. Heart, slow down. Got it? And blood vessels, open up. Got it? Dilate. So that we can bring our pressure down. Oh no, another day my pressure is low. Same baroreceptors talk to the brain, and the brain says, okay, heart, speed up, and blood vessels, tighten up till we get back to homeostasis. Got it? Now, who are we going to see at the hospital? Somebody whose homeostasis can't get back. Got it? They are in, high blood pressure constantly. What do we call that? Chronic. Or runaway, but chronic. What does chrono mean? Time. So, was this high blood pressure high just today? Just this week? For years. Got it? It's been climbing higher and higher. It's chronic. What does that mean? He can't get it back to normal. That's why he's at the hospital. That's why he's at the doctor's office. And it's up to us now in the medical field. Let's see, what kind of preventative medicine or whatever can we get to get him back into homeostasis? All right? All right. Okay. I thought I had. Okay, vasomotor center. All right. Okay. The part of your brain that's called the vasomotor center is going to talk to what?
The motor side of your brain?
No. It comes from the motor side of your brain.
Oh.
But what is it? Who's it going to talk to? Yeah, the vasos, your blood vessels. That's the one that's going to tighten down your blood vessels. All right? What's the other part of your brain? The one that talks to your heart?
So it regulates it by talking to the vessels.
Yeah. The message goes straight to the vessels. Okay? See? Vasomotor. Got it? You got it? It's a motor nerve to tell it to do something, and it's going to squeeze. What part of the blood vessel gets squeezed?
The inside?
The muscle. Made of what? Skeletal or smooth? Smooth, yeah, okay. Now, there is another part of your brain that talks to your heart.
Well, I thought smooth muscles were involuntary.
They are, that's what I'm saying.
Like involuntary, as in we can't tell them.
We can't
Like,
tell them.
We can.
The brain
our
can tell
skeletal
you, but
muscles,
we can't.
we tell them what to do.
Yeah.
Oh.
Yeah. The body tells us what to do, but we can't. Yeah. Consciously. It's called unconscious or involuntary. Okay? So, if the vasomotor center talks here, who talks to your heart? The cardiovascular center. What's the most important word there? Cardio. Got it? The cardiovascular center talks to your heart first. All right? All right. All right. What do chemoreceptors pick up?
Chemicals.
Chemicals. All right. So let's take a look at the chemicals that will increase your blood pressure. I'd make a card out of these 4 or something. Because you've got 4 that make your heart speed up, and you've got 4 that make it slow down. And on my test, if I say which one is the one that speeds it up, don't pick the one that slows it down, okay? All right. It's not really speeding up your heart as it is increasing your blood pressure, okay? We're not really necessarily talking to the heart all the time. All right, what chemicals released by your body are going to increase your blood pressure? Well, First of all, what's gonna increase my blood pressure? This or this?
Constriction.
Constriction. Epi and norepi do that. Okay? Oh, ADH. Really? I thought ADH was only for your kidneys. No. ADH has two functions. We've learned that it tells the kidneys, hold your water, don't pee as much, but we haven't really talked about it till now, that it also constricts your blood vessels. Well, what's the purpose of your body releasing ADH? Renin-angiotensin mechanism. What did the ADH do?
Hold water.
Tells your kidneys to hold water because I want to do what?
Increase
my
blood volume.
volume. But by increasing my blood volume, am I not trying to increase my blood pressure as well?
Yeah.
So it actually helps with your blood pressure. Write this down. Another name for ADH that we use in the hospital, vasopressin. Now, holy cow, what do you think this word is trying to tell you? I am pressing down on my vasos. Okay? All right. Angiotensin 2. We know that because angiotensin does what? Tenses your angios. Oh, what is pain in your heart? What kind? Like angina pectoris, because it's in your chest. Got it? Okay. And we also happen to have in the endothelial lining on the inside of our blood vessels, endothelium-derived growth factors that actually are also vasoconstrictors. Okay? So that's just what you gotta memorize, all right? They happen to be vasoconstrictors as well. So there are the 4 vasoconstrictors. You know, put them on cards, look at them, make sure you memorize them. All right. Now, let's look at the 4 that are the exact opposite. They're gonna lower your patient's blood pressure. A and P. Because we're peeing out the salt, out comes the water. Got it? I have less water and less salt, so I have less pressure. All right? Oh, by the way, who releases this? The heart. Okay? Another one is nitric oxide. It's just a chemical released in your body that does this. Opens up blood vessels. Got it? All right. Now, Viva Viagra. Okay, Viagra is a chemical that makes your body release nitric oxide to open up your blood vessels.
Because
All right.
it's the same one that keeps stuff to sticking to the walls.
Yeah, and it also happens to be the one that keeps platelets from sticking to the walls.
Okay.
But it's not a paracrine. What's a paracrine? A paracrine is a chemical from this cell to this cell. Got it? And when it goes to this cell, it makes this cell do something it wasn't doing before. See, it's a hormone, but short distance. Nitric oxide just says, don't stick here. It's not telling the cell, do something you weren't doing before. It's just a repellent, okay? All right. Histamines, prostacyclins, kinases, etc. Number 1, histamine, is again inflammatory, which opens up your blood vessels. Remember, too much of it, anaphylactic shock, right? If it happens right here, you get your inflammation, right, with the swelling, right, and the redness. But if it's your basophils in your blood releasing all of their histamines at the same time, every blood vessel opens up, your blood pressure drops to 0, and it's anaphylactic shock time. And then this one, okay? It's not direct. This is kind of indirect, because what's alcohol going to do? It's going to tell ADH, stop working.
And when you lose
And the
water,
lack of ADH is what's going to bring your blood pressure down.
'cause
Got it? The lack of don't pee hormone is going to make you do what?
Lose volume.
Pee more, and if you pee more, aren't you losing volume? There goes your pressure. Okay?
Okay, then nitric oxide, can you explain again why would it decrease the blood pressure? Sorry,
Dilator.
it dilates.
When you open up your blood vessels, whether it's histamine or nitric oxide,
Mm-hmm.
blood pressure goes down. Okay? That's why, what does epinephrine do? Tighten it,
Constructs, okay.
which brings your blood pressure up. Got it? So that's the key thing here. And this is again why renin-angiotensin keeps showing up. What's the purpose of the renin-angiotensin mechanism? Why does it have 4 jobs? Job 1 and 2 is tighten your blood vessels. Got it? Venules, arterioles. But what's the second 2 jobs? Hold your pee to bring up your volume. Well, he's decreasing, right? But what, dilating, sorry. But what are these 2 doing? Decreasing your blood volume. Got it? Your blood pressure is based on 2 concepts. How tight are the blood vessels themselves? How big is your lumen? And how much do you have in the blood system? The more water you have in there, the higher the pressure. Think about it. If you have a garden hose and you only turn the spigot on halfway, how hard is it coming out? Turn it all the way up, don't you have more water, so more comes out? That's all. And the renin-angiotensin mechanism is the perfect example of how volume and pressure work together. Got it? You just got to remember, what's high volume going to do? What is constriction going to do? What is dilation going to do? And what is low volume going to do? Got it? That's all. But all of these things are based on those 2 concepts. All right. Now, long term. That's short term. Chemicals in the blood. Boom, short term. Long term is always your kidneys. Long term is always your kidneys. Your kidneys are there to get rid of that extra pressure by peeing out more water. Which is why, if you're having trouble and you've got swollen ankles, what does the doctor give Grandma?
Water.
Yeah, exactly. Which is actually not to have her hold water, but to have her pee out the water.
It's like
Right? Lasix, for example. Okay? All right, good. Exactly right. Okay. Remember, the kidneys are either direct or indirect. They directly influence how much you pee or don't pee. They indirectly influence angiotensin being produced and tensing or not tensing your blood vessels. Because your kidneys don't directly talk to blood vessels.
So direct is.
Pee or don't pee.
Indirect is
Angiotensin. Creating angiotensin so it can tell your blood vessels tighten or not. Okay?
so pee or don't pee because it's
Pee or don't pee
Holding
is
the-
direct, because that's your kidney saying, I'm gonna pee or I'm not gonna pee,
okay.
okay? All right. Okay, perfusion. What's the prefix per? Through, okay? Go through. And fusion here does not mean fuse it together. Fusion means flow. Flow, okay? So, tissue perfusion means how much blood is flowing through my tissues. Am I constricting it and not letting a lot of blood go? Or am I dilating and letting more blood flow to my tissues? Got it? Why? I think we talked about this last time. Raynaud's disease. Why are people's fingers cold? Do I have more blood flowing or less? Exactly. I've got less. Oh, and test question. What creates the shunt that keeps the blood from coming up here?
Shunt.
Did we talk about shunts? Shunting the blood away from this part of my body so I can.
Oh, because it's only a one way.
Yeah.
It's
Well, but we don't do that, that's what penguins do.
I thought it was because it was a one-way.
Precapillary sphincters tighten
Whatever that is.
to make the blood go through the capillary bed, not into it. Remember that? Double check it, make sure. Double check it. It's the precapillary. What's the wrong answer on my test? The postcapillary sphincter. Because that would trap the blood in your tissue.
Sphincter.
All right. So, tissue perfusion. Here is the most important thing as far as the clinical is concerned. Your blood flow into and out of every tissue, every organ in your body, if you're healthy, is perfectly timed. You don't get more, you don't get less, you get exactly what your brain needs, exactly what your kidneys need, exactly what your liver needs, okay? And how do we do that? Mostly by what? Local conditions. Got it? Oh, you need more blood, so your blood vessels open. You need less blood, so your blood vessels don't. Does that make sense? But it's local. Okay? What is the magic word that means it's happening locally? Okay. I hear some hesitancy. Nothing?
Intrinsic, okay.
Because in means it's happening locally. What's the one that means it's happening far away? Extrinsic. EX. From outside of the area. Intrinsic where? Right there. Johnny on the spot. Happening at the organ itself. Okay? Because what's happening is the local conditions that determine it. Got it? Example. Which arm is going to need more blood flow? Yeah. But is my blood pressure going to change? No. I'm going to send less here and more there because of the local intrinsic conditions. The condition here is I'm running out of oxygen. This condition is I'm not running out of oxygen.
So I can
So
give you some.
let's send the blood where we need it because your blood is all about delivering oxygen. Yeah, okay? If it happens locally, it's intrinsic, okay? All right. It's coming up. All right. Velocity, yeah, okay. Put a giant star by this, we'll come back to it. I'm following your textbook's PowerPoint. Put a big star by this graph, or these two graphs, okay? Remember the first graph, it was 120 over 80 and then the big drop, right? Okay. That's for blood what? Pressure. This is for blood volume and blood velocity, okay? All right, so you got a question like this as well. Please note, there's your big artery. These are your little arterioles leading to the capillary bed, little tiny venules leading to the big vein. Got it? What do we have more of? Arteries, arterioles, capillaries, veins, or venules?
Arterioles and venules.
Okay, arterioles and venules. We have a lot more of them. Okay? And remember, those are the ones that who squeezes first?
Angiotensin.
Angiotensin II. If I can squeeze all of these guys, I can influence the pressure in these guys. That's the idea. I can squeeze a bunch of these little guys, and that'll have a big influence on the big guys, because the big guys are so short, but the little guys are miles and miles worth. Okay? Hey, if we have so many capillaries, why don't we squeeze the capillaries?
Because they don't have muscles.
They have no muscle. They're just an endothelium. One simple squamous cell. There's no muscles. So I can't squeeze them. Okay? Now, what is important on Mr. Weber's test that the capillaries have no muscles? I have a test question that says, do capillaries influence your blood pressure? The answer is no, because they can't be changed anyway. So they can't influence. All right, now, total area. Now, if you're looking at your room as square footage, right? You've heard of square footage? Well, your body's not that big, so we call it square centimeters. Got it? Now, where do we have the most square footage? In the capillaries. It says it right there. I've got a lot more capillaries than I do arteries and veins, which makes sense. We've got miles and miles and miles of it. Alrighty? How much aorta do you have? From here to here? Is that miles? No. Okay. Alright, so, and of course, arterioles and venules are pretty big as far as volume is concerned, because these guys have the smallest square footage and therefore the smallest volume. All right? Look at this. Velocity. Where is my blood moving the fastest? Well, it kind of makes sense in your aorta. Isn't it pumping out at 120/80 pressure? So that's going to go pretty fast. Then it drops pretty quick, doesn't it? Where is it the slowest? Why? Say again? No, speed is not blowing out. Pressure is blowing them out. Why do we slow down the blood?
Because they're getting to their destination.
Say again?
Getting to the destination, like you're pulling into your driveway.
Yeah, but that's all. But when you pull into your driveway, what are you going to do afterwards?
Transfer.
Get out of the car. I need time to drop off the nutrients and pick up the waste. So I've got to slow down. Got it? Think about it. Doesn't the garbage man slow down to go pick up the trash, right? Well, here's the beautiful thing. In your body, your red blood cells are like the trash man. But he drops off your groceries and picks up your trash. Got it?
Or is it just one place where it's going the slowest, or is it arterioles, capillaries, and veins?
No, only the capillaries. There's only one place that's the slowest. Just like there's only one place that's the highest. Where's the highest velocity? Aorta. Got it? And the lowest is not the vena cava. That's the lowest pressure, but not the lowest velocity, not the lowest speed, is it? Okay. But I just want you to understand why this. See, I'm a visual learner. The graph tells me everything I need. This graph tells me 6 paragraphs worth of information. Okay? This has to have the most volume because I've got to get it to every square inch of my body. I've got to get nutrients and oxygens to every inch of my body. So I got to have lots of capillaries. This tells me I've got to slow down to exchange nutrients and oxygen for carbon dioxide and waste. Got it? I've got to have time to pick up the trash and drop off the groceries. When you have the trash man pick up the trash at your corner, is it free or do you pay for it? You pay for it. Guess what? Your cells don't pay for pick up and drop off. Besides, what's the currency that cells use?
Oxygen.
No.
Wait, calcium.
What's the energy molecule that we pay with ATP?
Oh, okay.
Got it? So if I want to pump something, it costs me ATP. But pick up and drop off, no ATP required. It's all passive. Isn't that nice? No cost. No cost. All right. Okay. Here's the intrinsic part. It's called auto-regulation. When you regulate yourself, not you, the body, but you, the organ, you, the tissue. Okay? We automatically adjust blood flow into each type of tissue as needed. The tissue that's not moving doesn't need as much as the tissue that is moving. Got it? It is controlled by what? intrinsic, local conditions. Local conditions. My brain doesn't have to be aware that this needs more oxygen and this doesn't. Because my brain is not in charge of, okay, let me decide, hey, maybe I should send more blood over here. We don't have to do that. But what remains constant the whole time?
The map.
What's your map?
Mean arterial pressure?
Your average blood pressure. It's not gonna change. Even though I'm sending more blood here and less blood there. The average stays the same, okay? Think about it. Is the average flow of traffic through Sumter gonna change because you pulled into the parking lot? Is the average flow through Sumter gonna change because I-95 is 70 miles an hour? No. The average flow is based on the local conditions. Oh, I see a red light, I better not be flowing. I see a green light, I better be flowing, or some idiot behind me is gonna honk his horn, right? Okay. Think of traffic just like your blood vessels, all right? Okay. Local demands, folks, local demands. Okay. Hypotension, is that high or low blood pressure? Okay. And for your textbook, it says anything below 100, all right? Whereas hypertension is anything above 140 over 90. Basically, most people say if it's 130 already, it's too high, all righty? Now look at these two words, transient and chronic. That's gonna be two answers, one right and one wrong. Which one happens today is gone tomorrow?
Transient.
Because that's what transient means, okay? What was the name they called hobos back in the old days?
Hippies.
No,
No.
hippies didn't. They pretty much stayed.
Hobos.
No, what was the other name for hobo? Hobo was the common name. No, I like that. What's another name for a vagabond? A transient.
Okay.
Because back in those days, they caught the bus or they caught a train into your town, stayed for a couple of days, tied up their belongings on a stick, and went on the next train to the next town. They were never in one place longer than a week. They were transient. Got it? They were riding the rails.
So they're momentary elevations.
Yes, momentary elevation or momentary drop. Okay? What's chronic? Long time. Got it? Long time. Oh, I do that. Clicker around somewhere. Okay, look at these cool words. Orthostatic hypotension. This is your patient stands up a little too fast and loses their consciousness. Okay, what does orthostatic mean? Let's see if we can understand it. My teeth are crooked, so I'm going to go to the orthodontist. My leg is crooked, so I'm going to go to the orthopedist. Because what's ortho mean? Straight. Straight. Got it? So, static means to stay. So when you stand up, you stay straight up and down, the blood might drain out of your head. Got it? Giving you temporary low blood pressure and dizziness. That's very important, especially at old age homes. You're going to be doing some clinical rounds in there your first semester, so make sure that, grandma, help her get off the potty, because if she gets off too fast, you might get dizzy and boom, smack her head on the tile floor, all right? Okay. What if I have chronic low blood pressure? Well, maybe I don't have good nutrition. Maybe it's a warning sign for Addison's disease, all righty? Acute. This means all of a sudden low blood pressure. That's what acute. What's an acute angle? This big or this little? Little. So acute in time means very quickly, boom, all of your blood pressure goes to zero. That's your shock. Got it? Whether it's anaphylactic shock or whatnot. This could happen to those who were undergoing surgery. Aren't you losing blood? Yeah, okay. All right. Hypertension is a silent killer. Yeah, no big problem. We know that. All right. Okay, two kinds of hypertension, primary and secondary. Primary, this is the most common type, and we have no idea how to classify it as one problem. Got it? We can't identify one reason for it. The secondary is an identifiable reason, like kidney disease or atherosclerosis or Cushing's disease. Got it? We can pinpoint the reason why that person has high blood pressure. Okay? The rest of us, we got high blood pressure, and it's kind of what they call idiopathic. What's idio?
So,
No?
so.
No, not self.
Stupid.
Unknown. Yeah, see? I'm not gonna pick on anybody, but if somebody says, you're an idiot, it doesn't mean you're dumb, it means you don't know the answer. And patho is disease, so if it's idiopathic, it's a disease we don't know. Okay? We don't know what the disease is causing it. And that's why these guys, oh look, I've got too many red blood cells, I've got atherosclerosis, making my lumen smaller. Yeah, these are things we can definitely see is causing you to have high blood pressure. But for 90% of your patients, there really is not one cause. Okay? All right. How do I get my veins to send the blood from my feet back up to my heart? Okay? Skeletal muscle contractions. Every time you take a step, your muscles are pushing against your blood vessels. Your muscles are pushing against your veins. Well, the blood only has two places to go when you squeeze it, up or down. Can it go up? Yeah, because the valves open. Can it go down? No, because the valves close. And that's why we get more problems with our thrombus becoming an embolus if we're sitting too long. And the big problem is usually underneath here in your popliteal region with your legs hanging off the chair, which cuts off circulation. Are you with me? That's why, what do we have in our offices? Not exactly in my classroom here. What do we have in our offices if you have to sit for a living? Ergonomic chair. What's ergo? Work. Okay, now, what's nomic? What's nomenclature?
It's to promote, right?
Huh?
It's to promote, right?
No.
No?
Never heard the word nomenclature? That's an English word. Okay, how about to nominate somebody? You don't appoint them. That's appointment. What's
Volunteer.
nominate? You name them. Got it? So, ergonomic means work in name. All right? Now, what are we talking about? If you could adjust your chair, am I going to get more work out of you or less? If I have a desk, can't flow down because these valves are closed. Where are we seeing valves just like this? In the heart. Those are your semilunar valves, half moons, the ones in the aorta and the pulmonary, okay? Trunk. All right. So that's one thing we do. All right. Do we breathe? Do we breathe all night? The changing of the size of your chest actually draws. It's a suction that pulls blood up. Okay? And then, of course, constriction. All right? That what? Somebody said something. Yeah, okay.
You have, 5, reasons that,
Okay, I'm sure we'll get to some. All right, so here you go. That's the 5. The difference in pressure. What's the pressure in the capillaries of my foot? 20. Remember, we said capillaries are 40 to 20. So coming out of my foot, it's 20. But what is it in my vena cava?
0.
Is it 20 still higher than 0? the pressure gradient is still going forward. Got it? Gravity, we gotta watch out for gravity as it pulls the blood down, okay? Your skeletal muscles pumping and squeezing, as we just said. Your thoracic pump changing the shape of your chest every time you breathe. And your heart, when it pushes out blood, creates a suction if we push it out on what side? What side of the heart do we push the blood out of? Left, which creates a suction on the right to bring the next set in. Okay? So those are the 5 reasons that our veins flow back. Okay? Gravity, hey, I thought gravity's gonna make blood say, but gravity here is pulling it down to my heart. Got it? Gravity here. I don't have to pump this stuff. All right? Okay. Negative pressure gradient. We talked about that, okay? Yeah, it wasn't until, good Lord, the 1600s that we realized, hey, maybe blood flows in a certain way in one direction, not in all directions. You know, like tying somebody off and then, okay?
Cardiac.
All right. And it wasn't until the 1800s that they decided, oh my gosh, maybe we shouldn't bleed our patients because we could run out. Got it? They thought blood was unlimited. All right? Okay, cardiac suction, we got all that, right? Now, what if I pool my blood? Is that a good idea? No. Okay? And so you could get, what happened to this guy? Yeah, he passed out because the blood pooled and down here, thanks to gravity, out of his head and brain wasn't working anymore. When you're standing in parade, how do you do that?
Lock knees.
You don't lock your knees. You
Yeah, 'cause if you
never.
lock your knees, you fall.
But the fact that you're a little bit bent makes you move a little bit. Got it? If it's locked, you're not moving at all. Got it? So you got to be very, very careful. So sometimes they kind of tippy toe a little bit, you know, on the ball of your foot. Anything to keep the circulation moving. Okay? By moving your muscle. Okay? And that's the shock is, hey, one minute you're standing and the next minute you're not standing. All right? Okay. We've talked about this. What's that mean? Who created this problem?
The heart.
Yeah, your heart is not pumping. All right? Low venous return. I can't get the venous blood back. Nothing coming back to my heart. Heart says, I stop. What's hypovolemic shock? Low volume, because you've lost blood. Okay? That's why, did we talk about this? Burns. You burn, all the water comes out of your body. Obviously, tumors and things that obstruct, and then the pooling shock. Okay? That guy. I know we've talked about these two. A bacteria toxin, making the histamines open all your blood vessels, and here is eating something that you're allergic to. And why is it eating? Why is anaphylactic shock always something you ate?
It goes directly in your blood.
It's got to be in your blood before all the histamines in your blood are released. If it's just here, it's going to be local. Got it? It's got to be in your blood. All right. That pretty much covers all of it. Time. Okay. What's today? Wednesday, the what?
One?
Is it the 11th?
Mr. Weber,
Oh, crap. I'm missing a meeting. Yes.
for the total vascular area, the highest is the capillaries, and what's the
Yes.
lowest?
Arteries and veins.
Okay.
Yeah, big arteries and big veins because they're so short.
Okay.
Kind of interesting, huh? You would think, oh, big arteries, big veins, they got the biggest of everything. No,
Because they're short.
no, they don't.
Cool beans.